Joining us this morning for our weekly series on kids and the coronavirus, Dr. Namisha Amin, a local pediatrician. Dr. Amin, thanks for being with us. I first just want to start off by asking you, you recently shared on your social media about your experience getting the vaccine recently. How are you feeling? What's it been like?
I am feeling well. I received the vaccine on Monday just before noon, and I had a little bit of arm soreness that started that evening and went through the early morning, and that settled down. And then last night I sort of had that feeling like, am I starting to get sick or am I going to be okay? Maybe a slight chill, a little bit of an ache in my neck. And then this morning I woke up and I feel great. So I certainly can't complain, and I am so grateful to have received the vaccine.
Let's talk about the Moderna vaccine now. We know the Pfizer vaccine is currently only approved for people 16 and up, and we've spoken with you about that. Is there a difference in the age limit here for the Moderna vaccine that was recently approved? And do you think both of these vaccines will eventually be approved for children?
The Moderna vaccine has been approved for individuals 18 and over. Both companies are conducting trials with children 12 to 17. Pfizer began these trials back in October, and Moderna, I believe, has initiated the trial as of last week, but is still in the process of enrolling participants. So it may take a good 6 months at the very minimum before we can see data that we can rely on in this age group.
Okay, and what about children prone to having allergic reactions to medication? Should parents be concerned?
Right now, the recommendation for adults, of course, is that if you have had a major allergic reaction, obviously you want to talk with your allergist about it, but you are still a candidate to receive the vaccine. You are just being monitored for 30 minutes rather than 15 minutes after the vaccine, and of course in a medical facility where any type of intervention that may be necessary is readily available to you. If the data for children proves to be similar to that of adults, then I think that children with allergies will be very much a candidate to receive the vaccine as well, but again, likely in their pediatrician's office with close supervision.
All right, I want to move on and talk about a big side effect of the pandemic. In-person doctor visits are on the decline. Over the summer, the CDC reported that 41% of adults had delayed or just avoided medical care because of the pandemic. I'm wondering, is it important for children to have in-person doctor visits, or do you think that virtual visits are a good replacement? Are there any risks associated with only seeing a doctor over a video chat?
I think that a virtual visit is certainly a good way to start. Many times a very good history from the parent and a limited exam through the camera of a phone can tell us quite a bit, and we can give parents guidelines on what to do with their sick child. But there have been a few times where I just couldn't really extract enough from the virtual visit, and then we've asked the parents to come in. And most of them have been very amenable to that idea, just knowing that we at least tried and started the visit virtually, but then obviously to offer the best care to their child, it would be important to do an exam in person.
All right, and then I want to talk about this multi-system inflammatory syndrome. It's also known as MISC. A few weeks ago, we saw the first death in our state of a child from MISC. That child died in LA County about 2 weeks ago. It was released by the Children's Hospital in LA that the child had a complex pre-existing heart condition. And that hospital has also treated 32 other kids with MISC from ages 4 months to 17 years old. And 31 of those children have been successfully treated and discharged for MISC. What do we know so far about this syndrome?
So this is a syndrome that typically begins about 2 to 4 weeks after infection with COVID-19. And symptoms can include fever, vomiting, diarrhea, rash, extreme fatigue, bloodshot eyes, abdominal pain, and a variety of other symptoms. And essentially what happens is that inflammation starts to build within the body and sets in the major organ systems. And this causes the child to become very sick and often require a stay in the pediatric intensive care unit. Fortunately, we do know how to treat this syndrome relatively well. And so I believe of the 1,288 cases that we have had reported since March, there have only been 23 deaths. So it's not to say that it is a negligible number, but we are learning more and more about it. And because of the similarities it has to a different syndrome known as Kawasaki's, we were able to implement treatment for it relatively quickly.
All right. Well, that is a bright piece of news there, at least. Dr. Amin, thank you for joining us this morning. We appreciate it, and we'll talk to you next week.
All right. Sounds good. Take care.